Well, starting off the show, we are talking about mental health awareness. Now, May is Mental Health Awareness Month, and joining us now we have Vanessa Saenz, who is the Vice President of Behavioral Health Services, and we also here are joined by Dr. Adrian Agapito, who is the Chief of Behavioral Medicine. So I want to thank you both so much for coming in today.
Thank you for having us.
So let's talk a little bit about mental health. I know it has a whole month dedicated to it, and it's kind of a topic that a lot of people tend to shy away from, but it is something that, you know, we need to start having the conversation about. So kind of tell us a little bit about what people can do during this month to kind of have that conversation.
Sure. So Mental Health Awareness Month is in May. It's an opportunity for our community to come together and really, recognize the importance of mental health, within our communities. Right now, there has been a lot of focus on, minors and suicide rates, and it's important to really shift, our attention to that, to see how we can come together as a community and how we can really impact and build, that support, for our children. There's a lot of efforts that DHR Health has put forth to assist kids in schools. We have, local school-based health centers that are available for the community. We've also, come together with other of our community agencies to see how we can, join forces to help, the community. So, Dr. Agapito, I don't know if you'd like to add.
And definitely. So in terms of having that conversation about mental health, a topic that you say people tend to shy away from, it's also very important to note, at least from the medicine side, that there is a biological basis for a lot of these mental illnesses, because of the abnormal chemistry that takes place in the brain as a result of things like depression, anxiety, psychosis. There's a lot of medications out there that can treat mental illnesses, at least the biological aspect of it, while we also continue to engage in therapeutic services or minimize our social stressors. So in conclusion, I guess it's safe to say that with mental health, you have to look at three different aspects, which is the biological aspect, the psychological aspect, and the social aspect. And that could definitely be a conversation starter for a lot of people, that, hey, mental illness is not just something that you can get over. There is a biological basis to it. That's why a lot of the medications that I use for my patients work, because a lot of these medications can treat that abnormal brain chemistry that we often see in people with mental illnesses.
Definitely. And what would you say to people who kind of have the stigma on mental health awareness and getting any kind of treatment, whether it be, seeing a doctor or talking to somebody just about kind of what's going on? I think a lot of people tend to feel like they're alone, that what they're going through, nobody would understand, or they're afraid to kind of talk about it. So I think a lot of that time, it's good to just open up to someone.
So the way I look at it is, the way I try to explain it to my patients, to get them to open up about their mental health issues, is we can look at it like a biological illness. If you have the flu or you have a cold, you go to the hospital. If you have the flu, you have a cold, you're experiencing a lot of different physical symptoms. With mental health, there's also a biological aspect to it, like I mentioned earlier, and that often manifests as physical symptoms as well. If you're depressed, you're tired. If you're depressed, you can't sleep. If you're depressed, you won't be able to function at school or at work. Or even worse, your depression could get to the point where you start having thoughts of not wanting to be alive. And that's something that we definitely need to be a little bit more open about. Like she said, we have a lot of different resources out there for patients who are struggling with mental illness. In addition to treating the biological aspect, we can help them modify their environment. We can provide a good support structure for them, and just knowing that all these resources are in fact in place, and that there is a lot of research behind how the brain works when they have mental illness will go a long way in helping people become a little bit more comfortable in exposing themselves in terms of like their mental illness and getting help for their symptoms.
So I think that also parents, parents should, go out and really encourage their children to open up. Family members, if you see changes or patterns in behaviors amongst your loved ones, don't be afraid to bring it up. Right. It shouldn't be a topic that is avoided. It's something that we should be and feel comfortable speaking of, loud and clear, and that presence should be there from the get-go.
Most definitely. And I know you brought up the conversation of teens lately, and now I think that there's just a lot more with social media, and there's a lot more things that can affect just children and teens and even adults as they're kind of making their way through society. A lot of different things can affect them. Social media is huge, whether or not parents know kind of what's going on and what is affecting their loved one. They might not realize that, hey, there's something affecting them and that their mental health isn't where it should be, and it's kind of, it needs help, and they need help, so they need to have a conversation. So how would you recommend, I guess, approaching teens or children and kind of having that conversation with them?
So I think that social media can also play, a big role in being a key indicator. The fortunate thing is that, because it is a social network, many times, peers amongst themselves can catch on to patterns. I'm starting to see that a friend of mine or my daughter or my sister is starting to post, certain, themes, that maybe negative, photos or something with a negative connotation. Maybe they're not as active. These are all key indicators that can help provide some insight as to whether or not somebody may be going through something, so it can, potentially also help in that situation. And then on the other side of it, you want to also talk to your children about the importance of knowing how to navigate between some of the social networking bullying that's going on, and educate them on that, and discourage it more than anything.
Of course, and I think something very important that you did say was just educate yourselves on different topics and such. I think this is huge with mental health. I think you definitely do need to educate yourself and to understand a little bit better, because things are scary when you don't understand them.
Exactly.
But the more you learn about it, it gets easier to understand, and you understand the workings of things and why things are the way they are. So people definitely can educate themselves, reach out to you all, or to ask questions, whether it's something that they're curious about, whether they have questions, whether it's something that's affecting them, whether they might not even know that this is what it is. I think that's a great way to kind of move forward and understand things a little bit better.
Yes, we have a great team, so we're always available if it's just for a question. Anything that we can provide insight to, guidance, support to the schools, to the community, parents, we're always available. Our doors are open. Our behavioral hospital is 24/7 screening and assessment, so at any time, we're definitely there to support a community.
And it's also important to note that even after they get discharged from our inpatient facility after an acute crisis, there will be follow-up. I do have a clinic right now in Far Texas. I see kids of all age. I see kids and adults and geriatric patients. So there is follow-up. There are multiple resources out there that DHR provides at different stages of a person's mental illness. So.
Correct. Well, I want to thank you both so much for coming in and chatting with us a little bit about this, and offering some education to the public, and of course offering any resources as well for them. So thank you both so much for coming in.
Thank you for having us.
Thank you so much.
Thank you.